far as pandemic, there were concerns that Africa could be the epicenter of fatalities from the pandemic. However, this has not been the case, as the rate of infections and fatalities and recoveries shows that Africa is the second least affected region of the world. Joining me now to talk about this is Adjunct Research Professor of the Institute of African Studies at Carleton University, Samuel Ojo Olurontoba. Prof, good evening and thank you very much for your time on In Focus. What can we learn from the regional response to COVID-19, the role of the regionalism, the role that it played, particularly in this pandemic?
Well, thank you very much for this. The regional approach to addressing the pandemic flow from the previous struggle for independence, for liberation of African countries. We used to say that your problem is my problem, your challenge is my challenge, and that no African country can go it alone. And given the fact that the borders, which we have argued severally, are actually artificial and arbitrary, they are so porous that you see people moving from one part of Africa, in SADC, for instance, from Lesotho to South Africa, from Zimbabwe to South Africa, and things like that. So without a regional response, if South Africa is secure, is protected, there's no assurance that they won't be infected by somebody coming from Lesotho or vice versa. So that is to say that a regional approach is the right thing to do, is the right approach to take. And again, like I mentioned in the bigger article that informed the short piece in the conversation, many of the countries in Africa, they are actually what I call micro-states. They are states that lack the resources to respond to such pandemic of this huge scale. And given that fact, and given their limited capacity to access external assistance, pulling resources together at the African Union level, at SADC level, really help in mitigating a pandemic of this proportion.
Yeah, the fears were genuine. I mean, we do have weak health systems in Africa. We've got inadequate medical personnel. We've got a lack of hospital equipment and so on and so forth. How did the regionalism close those gaps?
Well, it has not completely closed the gap, and there's no substitute for investment in infrastructure, in health infrastructure. But the fact that we can mobilize resources across region, across the continent, with the African Center for Disease Control in Addis Ababa, training health personnel from all over the continent on a regular basis, providing information, mobilizing resources, that I think has really helped significantly to manage this pandemic. But like I said, it is not a substitute for investment in health infrastructure. Right. But given the fact that some of those small states, are called small state, micro state, they really don't have those capacity for testing, for tracing. But a regional approach, a continental approach, really help to, balancing those resources and making them available to a great extent.
So looking at Europe, looking at Asia, and looking at Africa and drawing comparison there, some of the instinctive reactions from countries, for example, in Europe to COVID-19 was for those countries to look inward and act alone at it. Why was that a bad strategy?
Well, because they are relatively okay economically, they are relatively okay in terms of health facilities and even medical personnel. Many of our African nurses and doctors, they are in those countries working, maybe because of better pay and better working conditions. So they can afford to do that. But of course, that is also not sustainable in terms of economy. It's not sustainable. That's why you see a move towards, going back and forth and, trying to reopen the economy and that. So it's a global issue, and like President Ramaphosa has argued severally, this is a global concern. And so a national approach to it, despite the rise in populism which is now closing the borders. This pandemic has really made us to know that our shared humanity cannot be compromised, because no country can be an island to itself, right? So the EU, they try to start with that national approach. Even at the EU level, they also try a regional approach. But for Africa, we don't even have an option. We don't have an option in taking the approach that we have taken, because it would have been worse if that approach was not taken.
Yeah. One would say we were really forced into this kind of arrangement as a region because really, we, as you put it, we had no option because of the many deficiencies that we have in our systems and the lack of resources.
Absolutely. Absolutely. The lack of resources, and like I argue in the paper, imagine a country like Lesotho. I'm sorry, always mentioning Lesotho, and I like them, even though I've loved them there. Or Benin in West Africa, or Togo, approaching the World Bank or the EU or MasterCard Foundation to provide funding to address this problem. Their voices are very small, this country. So, but when African Union go, as President Ramaphosa did when he was the chairperson of African Union, it carried more weight, and it was able to mobilize even the private sector across the continent. So it's worked better than that, which is the point where we have been talking about Pan-Africanism, that we need to return to Pan-Africanism, that we had a pre-colonial Africa that was not shackled by borders, that we should see ourselves as one, because the pandemic, for instance, does not recognize nationality. They don't care where you come from. The virus didn't care where you come from. All we need is a collective response that can help us to solve the problem. As it appears to be health problem, so the same way it's applied to economic problem.
Yeah.
That for Africa to play very important role in the global economy, like Kwame Nkrumah has argued some 60 years ago, we need to marshal our resources together. We need to have a stronger voice as one continent rather than working in silos.
Now, the African Union as the convening power leading the coordination of the fight against the pandemic on the African continent, sometimes criticized for not sufficiently responding to the pandemic. For example, when it comes to resources and getting the necessary vaccines, we're still lagging behind.
Lagging behind, yes, because, again, that also called to question the issue of dependence. It's painful for me, as I was writing that paper, to see that African countries are waiting for other parts of the world to develop vaccine, to donate vaccine. It's a shameful thing. It's a shameful thing, because when you look at some of the countries that are actually producing, whether in Pfizer or Moderna, all these companies, many of them you see African scientists working there. The question remains, why can't we produce our own vaccine? So yes, African Union may be lacking, and that's unfortunate, but the question we must ask ourselves is, why must we depend on donors? Why must we be waiting for donors to give us vaccine? Some people are saying Canada has more than what they need. Yeah, because the economy grows. Why can't we allow our economy to grow? Why can't Africa pool the resources together, stop corruption, develop developmental elites that can bring about transformation in our economies, which is the point we have been making forever. Yeah. So my point is, African Union needs more capacity as well to do what they need to do. But you will agree with me that if those vaccines were available in Africa, if there's a company in South Africa or Nigeria or Ghana manufacturing that, it would have been easier. Because not getting those vaccines from the US or the UK might not just be a logistic issue, it may be a political issue. Because, like I keep telling people, no free lunch in Paris, no free lunch in Pretoria, no free lunch in Washington. Whoever wants to give you anything, they have some interest at the back of their mind. So we must ensure that we develop our own capacity. If you read the full article, I made that conclusion. Yeah. We must develop our own capacity to manufacture locally.
Yeah. How do we develop that capacity? How do we strengthen, or let me say, how does the region and the regional bodies help member states to strengthen that capacity at a level of maybe politics or even at the level of economic interaction?
That's a very important question, and I thank you for asking that. The issue is we need to deconstruct what we understand by an African. If you remember the patron, President Thabo Mbeki, I'm an African. If we understand our commonality as African, if we understand that when we develop economically, we become a powerhouse, we'll be proud of ourselves. So the rhetorics and the difference between the rhetorics and the practicality of regional integration, which our political leaders used to do, needs to be addressed. I attended a conference in South Africa in 2013 on regional integration organized by the African Development Bank. And Dr. Ibo Mandaza from Zimbabwe told us that the experience with SADC is that the presidents, when they want to nominate somebody to SADC, they don't nominate a senior official from the ruling party. They nominate just somebody. Because the politics of nationalism and the politics of difference does not allow our leader to see the benefit in regional integration. They just talk about regional integration because it is fine to talk about regional integration. Hardly do you see those leaders like Thabo Mbeki who believe in African Renaissance, people like Obasanjo, people like Abdoulaye Wade, that work together to bring about NEPAD in 2001. Many of our leaders, they are just so encumbered with national politics that they don't understand that we need a regional cooperation to be able to boost our economy. We need a regional integration to be able to increase our capacity to develop. When trucks are carrying goods from South Africa to Zimbabwe or from Nigeria to Ghana, you know how many roadblocks that they face. Those roadblocks are not necessary. They stifle economic opportunity. They stifle economic growth. So to your question, we need to deconstruct our mind to say we are Africans. Yes, tribes may differ, ethnicity may differ, but that doesn't matter when it comes to building economic capacity, which was the point that the early father like Kwame Nkrumah, like Julius Nyerere said. Nyerere said, when I appear in Paris or in New York or in London, nobody see me as a Tanzanian. They see me as an African. So, and an Africanist must not just be a slogan. It must translate to economic capacity. And so we need to remove all these shackles of, maybe a Nigerian company wanted to operate in South Africa. It becomes so difficult. A Senegalese company wanted to go to Ethiopia. It becomes so difficult. And then we welcome companies from China. We welcome companies from everywhere. But when it becomes so African company, so I was listening to the former ambassador of the African Union to the United Nations this morning at the conference, and she was talking about the issue of self-hate.
Yeah.
We hate ourselves as Africans.
Yeah.
Until we solve that, we won't be able to go far in stimulating economic growth.
Adjunct Research Professor at the Institute of African Studies at Carleton University in Canada, Professor Samuel Ojo Oloruntoba. Much appreciated. Thank you very much.